everyone, my name is Lexia Nelson, and today I will be going over our final week of ISP remediation for week 15. It's crazy to believe that it's been 15 weeks of doing ISP already. And I'd like to go at the very end, just kind of like reflect on my experience of doing ISP weekly. But first we'll just kind of dive into the results of my quizzes and everything, and then we'll get into that. So for Kaplan, I know that we're it's advised that we try to meet the 70%. That's our goal. The last couple weeks I was able to meet the 70%, but unfortunately this time I fell a little bit short. So there's been 4 weeks where we had to get a 70% or above. Out of two of them I have met. The very first week where we had to start getting 70s, I got like a 68 as well. And then this is our last week of doing that, and I got a 68 again. It wasn't really far, so I'm trying not to be very discouraged because I feel like even though I didn't meet the average, I'm still doing pretty well on the quizzes and exams overall. So I'm just really trying to stay positive in that sense, but unfortunately, I did work very diligently to meet the 70%, but I just fell a tiny bit short this week. Each quiz has 25 questions. The first one I got a 72, then a 60, then an 80, a 63, and then a 67 with a 68.4% average. For UWorld, I got a 76% on the New Gen Self-Assessment Exam number 5, which showed on the spectrum there's low, moderate, high, and very high for passing NCLEX, and I got a high probability of passing NCLEX, which is great. I've been getting very high and high on all the exams that I've taken so far for UWorld, so that's very assuring and helps me to know that, I'm remembering some of the content and I'm getting better at applying it as I keep going on. And then I did the 14-year-old videos and notes, and those were completed and submitted. And then for pass point exam number 2. So kind of like NCLEX, you can go to 85 or 150. I got stopped at 85. I got a mastery 8 on the exam, and I got a 74, excuse me, 0.12 out of 100% on the exam. Now for my top 3 missed questions. So these are all from Kaplan. So for this one, I wanted to include it as it talks about alteplase, and it's for a client with a CVAD access device, and it talks about contraindications. So all the main contraindication I knew about for alteplase was bleeding, but I did not realize that if there's like a suspected infection, then it could cause a systemic infection, as it can move that localized infection, which definitely makes sense. Now, as far as the ischemic stroke, I was thinking maybe it would be that one because it had to do with strokes and everything. But it says that it's a contraindication to dissolve the clot. If alteplase is prescribed with the intent of treating the stroke, the medication should be administered as soon as possible. So that's, and that's why I was thinking, because I know we have to give it as soon as possible. So I'm like, okay, if it was 3 months ago, I guess that's kind of where my mind was on that one. And then it talks about the need for long-term antibiotic therapy may be inserted, and it does not preclude the use of alteplase. So yes, that is the reason why. And then as far as sluggish return, it talks about not forcing it, as it could rupture the catheter or push the clot into the bloodstream as well. So for the second question, I know with DVTs or any venous instabilities and insufficiencies, that you don't want to cross your legs because that's just cutting off more blood flow, right? So in this case, I'm like, okay, the answer is I cross my ankles because we don't want them to cross their legs. But I didn't realize that with ankles, it's acceptable. But really, we're just more concerned with the thighs. But in general, I thought it was just like you're not supposed to cross your legs really at all. And whenever I wear tight socks, I know that the compression stockings we wear with DVTs or venous insufficiencies are meant to be, a little tight, like they're not going to necessarily be loose. So, that's why I thought it was that in this moment. But tight fitting that leave marks on the skin increase the risk of varicose veins. Because I guess that makes sense. If they're too tight, then obviously you're impeding the blood flow, or you're not yeah, that's gonna mess up the blood flow there as well. And it talks about increasing the risk of varicose veins. Yes. Oh, okay. So I guess what I take from that is you're just trapping the blood even more from moving. Okay, now for the last question, I put metformin as I honestly wasn't really sure. I guess I just put metformin because I saw sweating and I'm like, okay, maybe that can, because you can see sweating with changes in your blood glucose, but I did not realize that levothyroxine, so excessive diaphoresis is a common adverse effect of it, and it may be from too excessive dosing. And then other common adverse effects include increased appetite, weight loss, headache, and heat sensitivity. But now when I read that and I think about it, levothyroxine is given for a hypothyroidism patient. So if you're giving them too much, that's going to raise it up too much, which can cause symptoms of hyperthyroidism. So that makes sense now, after reviewing it. Now, areas of and for improvement. So I feel like I've been doing pretty good on it. Of course, I could always get stronger, is going with my gut feeling on answers for sure. Stay persevering. So if I just keep up my routine I'm doing right now, and obviously I'm going to be devoting a lot more time specifically to NCLEX studying after, because this is our last ISP. I feel like I'm going to continue to take notes, continue to do practice questions, and then I also need to start reviewing more of just on my weaker topics, as, now is the time to really start focusing on it, especially, closer to NCLEX, because, we take NCLEX probably around early June. Work on my comfortability in math. I feel like I'm really good at math. I just am not that comfortable in it. So I really think working on math extra as well will help me. And then lastly, try not to be discouraged, even if my grades are not always meeting my expectations. Like as we saw with Kaplan, like I didn't meet the 70%, but I still feel like I did a great job overall anyways. So I think just trying to stay positive in that sense will be very helpful. And then lastly, I'd like to just say a little note about ISP in general. So I've found ISP to actually be very helpful. There's some content that I've don't think I've ever really learned about. There's some content I, completely lost my mind that came back. I think this has been a great experience overall, using ISP. And, it's also good to use these resources during NCLEX studying as well. So I would just like to close with that note, and crazy to believe that we're at the end already. But yes, ISP has been very helpful, and I appreciate you listening. Take care.